Hey everybody, my name is Chris, and in in a week now, I will be facing spinal fusion surgery for my Schimmerman's kyphosis treatment. And the main reason why I wanted to make this video is because I wanted to be a listening ear to everybody. I wanted you guys to see what a person goes through when they have the surgery, because I know bald experience is better than any kind of advice you can get other than maybe from a surgeon's point of view. Seeing the surgery and seeing it performed and seeing what all you go through, it probably helps more than anything. I know it did for me, because when the surgeon said, yeah, you need surgery, I scoured the internet for videos. And I kind of thought, somebody's got to have a video. Somebody does. So the video diaries I've seen on Facebook, they made a big difference. Not Facebook, YouTube. Sorry, I got Facebook open in the background. That's what I got. YouTube. The video diaries I watched on there were a huge help. And I've actually befriended a few people on Facebook that had the surgery, and they've helped me out a lot. They've told me what I need. They've told me what it's going to be like. So I want to do the same for you guys. And hopefully, I'll make it easier if you guys go through the surgery and if you do it. Few things to know. Surgery is going to be hard. It's going to be very, very difficult. I already know that. Number two, you're never going to be 100%. You're never going to be back like you was. It's going to be a whole totally different life for you. And you're going to be just 100% just changed, I hope, for the better. I know that I'm going to be changed for the better. But I'm going to go over what the Schimmerman's kyphosis is. I'm going to post x-rays. I'm going to post pre-op, what they do for pre-op. I'm going to have videos of while I'm in the hospital. I'm going to come on and every so often give you guys updates. Maybe a 2-week post-op and a 4-week post-op and a 2-month and a 4-month and a 6-month, something like that. But for those of you who don't know what Schimmerman's kyphosis is, it's the abnormal curvature of the spine. And there's different types of kyphosis, actually. There is Schimmerman's kyphosis, congenital kyphosis, postural kyphosis, or kyphosis related to some type of a accident or a failed back surgery that could cause kyphosis. There's all different types, actually. And I'm going to post a link at the bottom of the page that will give you guys more insight as to what this is. But for me, my kyphosis is Schimmerman's kyphosis, and what that is mainly is the abnormal curvature of the spine. The abnormal curvature of the spine, because the building blocks of the spine, the vertebrae, don't stack up as evenly as they should, so it causes an excessive curvature like this. It's excessively curved, and that's called a kyphotic curve. And looking at my phone just a while ago, sorry. That could lead to all kind of problems. It could lead to decreased lung capacity, heart issues, because when you're stooped down, it's going to cause decreased chest cavity space. And so you're going to have issues with that. Breathing. Problems with your heart. Fatigue, because you're not bringing in as much oxygen as you should when you breathe. So when you run or when you otherwise do physical activity or pick up something heavy, you may have to breathe harder, which causes your body and your heart and your lungs and everything to work harder. I've really searched a lot on this, and I know through and through what it is. But my curve right now is at 70 degrees. 70 degrees, and what they're going to do in surgeries, they're going to go in, they're going to place, they're going to fix the building blocks. They're going to take out the bad vertebrae. They're going to put in the new vertebrae with the new bone, basically from cadaver bone or from my own hip. The surgeon said he's going to choose when he goes in there what he's going to do. And he's going to also put in 2 metal rods, and then he's going to take screws and basically put those 2 metal rods in my spine. My surgery is going to last at least 10 to 12 hours, he said. I'll be in the hospital for at least 5, if not 7 days. And I'll have a pain pump. I'll have, of course, pain pills after the surgery when I go home. And all that stuff, I'll update you guys on how it is and how the pain is, post-operatively, and how I'm progressing and all that. Bottom line, guys, is it's not the end of the world. The surgery's not. It's not going to be the end of me. I'm very strong. I'm semi-healthy. I mean, I'm pretty healthy, I'd say. I'm not too big. I'm not too small, actually. I'm just right on my weight, and I eat right. I don't smoke. I don't drink, which means if you guys do smoke, stop. Stop smoking. If you have this spine surgery, you cannot do it when you smoke. You cannot do it. Don't even think about it, because it affects so much of your spine. It affects so much of the healing, and I'm not a real big fan of smoking anyway at all. Sorry, the light back there's in the way, but anyway, guys. I mean, it's not the end of the world. It gets better. It does, and I hope that you guys don't have to go through the surgery, but if you have this problem, all I'm going to say is go to a surgeon and fight for the surgery. They don't like to do them unless it's a severe case. And if you don't fight for it now, and if you give up because you continuously went to the doctor and you have to fight, and you've given up the fight, don't do it. Don't let it happen. Don't let it happen, because if you do, it's going to cause more problems if you just let it go and you don't do anything. Now, it took me 4 to 5 different times, I know at least 4 or 5 different times, to go to the doctors and go to the surgeons and have them do it. I went to one in 2009, one in 2010, another in 2012, and then another in 2016, just January of this year. Each time they had me go through physical therapy 6 weeks, and this past time he had me do an epidural. Physical therapy didn't work and the epidural didn't work. And I'll say something about those epidurals. I don't understand why the hell they give them to women. How can for all the women out there, how in the living daylights can you guys give birth to a shot that just makes you feel like you gotta pee? I mean, it just made my whole rear end and my whole downstairs area feel hot. And I mean, not saying, I'm just like, God, really? That's all it did. No pain, relief, nothing. Maybe for like a day, and then it came all right back. I'm going to tell you guys the main 3 reasons why I did this surgery, why I'm going to do it. A is because of the pain. Now and in the future. When I get up in the mornings, my pain is just 8 to a 10. It takes hours for it to go away. When I sit down for more than 30 minutes and when I stand for more than 30 minutes, my lower back will start having that pressure-type pins pain. Thankfully, I don't have any neurological symptoms or this, that, and the other. Thank God I don't. Number 2, I'm doing it because of the fact about my future health and what it's going to do to me and my confidence and my emotional health and my see, this is me standing up straight, but I'll go into that in a minute. I'm doing it for, number 1, my pain level. Number 2, my confidence level and my health from the standpoint of present and future health issues. And number 3, I'm doing it purely for cosmetics and appearance as well. That's got a lot to do with it, because sitting like this will make you feel, sitting like this will make you feel like you're 80 years old. Sitting like this will. When you're really supposed to be sitting up a lot straighter, maybe not that straight, but, I'll let you guys know when I'm done. This is how I am normally. Let me pull this down. This is how I am normally, and I'm trying to get some good pictures so that I'll know how I am later. And then this is how I am like this. That's the cat toy right there, by the way. And then this is how I am like this. So, and then this is how I am when I try to correct it. Which, it's still curved. You can still tell a curve there. But, like I say, guys, I will update you on what happens. I'll come on and give you guys periodic updates. the night before the surgery, I'm going to come back on and do another video. And then during the surgery, you'll see pictures, and I'll post X-rays. I'll post a link of everything in terms of what this kyphosis is. And number 4, I will also post periodic video diary updates so that I can also look back. And I want to look back on this and see the progress I've made and see how I look now versus when this surgery's done. So I want to have like a video of it too, so I can go back and look at it. Like I said, guys, wish me luck. Pray, please. I need that. Please. I'll talk to you guys later.